The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, everybody. Welcome to the live stream edition of TMD Demystified. I am Tony Urbanek. I appreciate you being here. I hope that in the next 30 minutes or so you can learn something about temporomandibular joint disorder that you can apply to the millions of people, primarily women, who have this problem, this disease, which is a quite easy to understand disease. I have spoken on it, written on it, have a blog, a podcast, and now a live stream. The live stream, for those of you who are here for the first time, is designed for viewers to ask questions and make comments. That's what I would prefer. There is a lot that I've written and spoken on this problem, and I think that the public, and especially the dentists, need to know the facts regarding this disease and not all of the, frankly, nonsense that has been, the word that comes up is perpetrated on the public over the past 70 years or more regarding the disease itself, what it's all about, and certainly how to treat it. I make no bones about it that there is a problem out there with the dental profession and dental community treating this problem. And the patients know it, the physicians know it. All providers know that this seems to be a conundrum when it's really not. It is not a conundrum. Actually, it is a disease that is easily understood and explained when you understand the primary cause of the disease. It is not a disease of multiple types. It is all caused by chronic inflammation within the temporomandibular joint. But we're not going to focus on that too much today, although I may comment on it again. But in 2026, and today's date is Saturday, July 18th, 2026, the current standard of care in dentistry for treating temporomandibular joint is the following. 50% of the dentists make a night guard, which is a great device for protecting the teeth, and give that night guard to the patient and tell them that this is their treatment for temporomandibular joint disorder. 49.95% of the remaining dentists put their fingers in their ear when they hear the word TMD, when they have a patient with TMD, when one of their patients says, I need some help, I have some of these symptoms of temporomandibular joint disorder, and the dentist says, I don't know anything about it, I don't do that, that's a complicated disease, you'll need to go elsewhere. And then there are 0.5% or maybe 0.1% that I call, rightfully so, TMD gurus, G-U-R-U, guru, who use nothing more than smoke and mirrors and voodoo to treat this disease. At very best, trying to treat symptoms very temporarily. And the latest guru treatment is Botox, which will paralyze your face wherever you put it in, will paralyze a muscle for a period of time, but then has to be repeated. And of course, the symptoms move around the face and the neck and the shoulders, and certainly the Botox and folks are getting wealthy by selling Botox, but it isn't treating the disease. And that is my position. And I open it up on this very informal presentation that I make available to both public and dentists to comment upon on my comments. So I'll be watching the live stream, and if anyone would like to speak up, I'll be happy to review or comment on your question or your comment. But today I was doing some outside reading on a totally different topic that I've been working on, and I ran across a quote that I think is very appropriate for the specifics that I have to teach about temporomandibular joint disorder, how this all came about, but about the disease itself. And this quote, when I read it, I had to look up the author of the quote, and that is what I want to talk a little bit about, and then we'll talk about the quote itself. But this quote is by a individual named Sir William Bragg, and he says, "In science, it is not necessarily important to discover new things, but to discover new ways of thinking about them." And when I read that quote, that is exactly what I did to discover, in air quotes, because I didn't discover anything. The information was out there. The science was out there. But I just read the science, multiple areas of the science, different areas of the science, and then put a different way to think about those, basically connecting the dots, which immediately explains all the symptoms of temporomandibular joint disease. So who is, just to make completeness here, I don't want to just leave you hanging, and I think I read the author, I looked up the author on AI and asked a question, so let's put a little validity into his quotes, because anybody can quote anything, and I was not really surprised when I discovered that Sir William Bragg, July 1862 to 1942, was a British X-ray crystallographer who uniquely shared a Nobel Prize with his son Lawrence Bragg in 1915, prize in physics, for their services in the analysis of crystalline structures. And let me see here. Bragg, alongside with his son, developed the Bragg's law, which describes how X-rays diffract when hitting crystal planes. This breakthrough allowed scientists to determine the atomic structure of crystalline substances for the first time. Their work laid the foundation for modern solid-state physics and was instrumental in later discoveries, such as the double helix structure of DNA. He also invented the X-ray spectrometer, the prototype of modern distractometers. So his quote, I think, has some validity. This gentleman was quite well known in Britain and won the Nobel Prize. And I'll read it again for emphasis. In science, it is not necessarily important to discover new things, but to discover new ways of thinking about them. So he claims he didn't necessarily discover new things. He just took the information that was there and connected the dots and won a Nobel Prize. Now, I have no feeling that what I have to teach, what I found out, is going to win a Nobel Prize. That is not what I'm saying, for sure. But I think it's very important for the doctors and the millions of primarily women who have the disparate symptoms of temporomandibular joint disorder to quit being run around in circles about this problem, literally circles for decades. You've heard me speak for those who follow me along, how many thousands of patients I have personally seen who have been seen by 5, 10, or more doctors trying to explain and treat the various symptoms of temporomandibular joint disorder, and have gotten nowhere and spent all kind of time and frustration and money and insurance benefits, or not, because it's really TMD, thanks to our insurance companies, is not covered by TMD primarily, and this is my position and I stick by it, by primarily, almost exclusively, by the very poor performance of the dental industry in trying to treat this disease. Extremely poor performance. So earlier this morning, I was thinking about what I wanted to actually discuss, and I read this quote. I was planning on discussing portions of my last podcast, because I always take a topic for the week. I do a blog, I write a blog, put some thoughtful words into the blog, and then usually the podcast done 2 days later is associated with that blog. And then the live stream, I usually, which is informal, leave it open to talk about questions about what I wrote, or further information that I can give about it. So the blog that I wrote last Sunday evening, and the podcast that I always record on Tuesday morning, was on one of the disparate symptoms of temporomandibular joint disorder, just one. And it is quite an unusual disparate disorder, but can be proven is associated with inflammation of the temporomandibular joint. And that disorder is arm, hand, or finger tingling or numbness or pain. Now, I came across this symptom because patients who would come in 3 weeks, 2 months, 4 months after beginning treatment would tell me their headaches were gone, their neck pain was gone, their fullness in the ear had decreased significantly or gone away. But they also had 3 separate ladies come in over a period of about 8 months and say, all of these other symptoms went away, thank you so much, but it also, is that having to do with my arm, hand, finger tingling and numbness? Because it went away also. And the first 2 patients who gave me that information, I just basically filed it away, but blew it off. I had no comment. I had never heard of that symptom before. But when the third, and they were all females, came in and said, my arm, and especially my fingers, and especially these 2 last digits on the hand, although it can go all the way up the arm, forearm, wrist, and any of the fingers. But by my observation now, after treating 5,000 patients, the most common complaint is the last 2 digits on the hand have tingling or burning sensations, which diminish when you treat the temporomandibular joint by unloading the temporomandibular joint, allowing the inflammation to go down. So for those who are new to the, or here for the first time to this episode on this live stream episode, the device and protocol is very simple. The device is a device that unloads the posterior temporomandibular joint, unloads the posterior teeth according to a protocol long enough to allow the inflammation to die down, just like a set of crutches unloads a damaged knee. If you don't need or want surgery, you don't need or want injections followed by surgery, then the orthopedic surgeon is going to give you a set of crutches and tell you that if you unload the joint, stay on the crutches, your knee pain will go away, and it does. And not just the knee pain, the muscles associated with the knee that move the knee, because that information has been available through the orthopedic literature primarily for better than 70 years. I believe I looked it up, I believe the first article written on this phenomenon of protecting the joint by making the muscles tight to hold that joint motionless to allow it to heal. That is a well-known phenomenon within orthopedic surgery. It applies to knees, it applies to hips, it applies to elbows, and it applies to the temporomandibular joint. And that phenomenon is quite simple. When a joint becomes inflamed, it sends an autonomic nervous system, sympathetic portion, up to the brain, which ends up in the brain stem. And in the brain stem, it's modulated, collected, and then information is sent back down through the autonomic nervous system to the muscles that move that particular joint to hold the joint still, motionless. Tighten up the muscle so the joint becomes motionless to help it heal. You got inflammation in the joint, and the muscle gets tight. It pulls on the periosteum of the bone where its origin and insertions are attached, and that creates pain. That creates pain in the leg, the muscles that move the knee. It creates pain, especially in the forearm of patients who have tennis elbow and the lateral epicondyle. There is inflammation of too much repetition of the forearm, and tennis elbow is complaints of pain in the muscles of the forearm. They don't complain of pain in the lateral epicondyle. They complain of pain in the forearm all the way into the wrist, where the muscles that move the forearm, the origin insertion of those muscles. That is the exact same phenomenon of temporomandibular joint disorder, singular disorder, that creates all the disparate symptoms: headache, earache, jaw pain, neck pain, ringing in the ears, subjective hearing loss, vertigo, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. But today, we'll just focus a little bit more on arm, hand, finger tingling and numbness. So I did a little query with the AI, and with the help of AI, we developed a diagram, which I'm going to share with you about this, and encourage anybody to look this over very carefully, because it explains that phenomenon that is well known to the orthopedic surgeons, how inflammation within the temporomandibular joint creates the muscles first of the face, the jaw, all the muscles of the face that control the motion of the mandible, the jaw. And when those muscles get the signal to get tight, they pull on the bone, and patients will complain of pain right here where the temporalis inserts, or right here where the masseter inserts, or under the chin where the mylohyoid inserts. And these muscle pains move around the face, sometimes on the right side, sometimes on the left side. They can be constant, they can be intermittent, they can be super severe and confused with migraine headaches constantly. And of course, my medical colleagues admit they have no idea what causes migraine headaches. They have lots of theories. But we know with certainty that headaches, bad headaches that are confused with migraines all the time, are originated from inflammation within the temporomandibular joint. Now, this same phenomenon actually then has created some patients who complain of arm, hand, finger tingling and numbness, and this is how it works. When the neck muscles, which is the next portion, holding the jaw muscles completely tight doesn't solve the problem. The signals come back down from the brainstem that says, now hold the whole head tight. And as any doctor who sees any number of TMD patients will tell you, neck pain is the second most common symptom of temporomandibular joint disease after headache. So when the neck gets the signal to get tightened, the brain is keeping telling you, tighten up. We got bad problems in this joint, make everything tight. Well, when those muscles get the signal to get tight, which are primarily, we call those the scalene muscles, and I'm not sure whether you can see my pointer, But anatomically, and I am degreed in cell biology and anatomy besides degree in medicine and dentistry. And this, when I studied this and looked it over in Gray's Anatomy, it became very apparent exactly how temporomandibular joint inflammation creates arm, hand, finger tingling and numbness. So if you're looking at this diagram, what it shows you is the brachial plexus, which is a group of nerves coming off of the coming through the brainstem and off of C5 through C8 and T1, the back of the skull, your cervical vertebra and thoracic vertebra 1. The nerves that come off of them come through and between the middle scalene and anterior scalene muscles. And when the nerves are in the appropriate place and the muscles are large enough or big enough and the circumstances go on that those muscles get the signal to get tight, they squeeze the brachial plexus between them. And squeezing the brachial plexus will create arm, hand, finger tingling or numbness or pain. So the sequence is quite simple. You have chronic inflammation. I'm going to read this for you so you don't have to read it, but I leave it up here for you to make it real to you. The sequence is how inflammation leads to the tightness of the neck muscles and nerve compression. The TMJ chronic inflammation in the TMJ stimulates the trigeminal nociceptors. The trigeminal signals the brainstem. The nociceptive input travels via the trigeminal nerve to the spinal trigeminal nucleus, then to the brainstem reticular formation. The brainstem then activates the sympathetic output. Reticular formation activates the sympathetic nervous system to increase muscle tone and stabilize the head and neck because of inflammation within the temporomandibular joint. And now we have doctors out there doing, really frankly stupid stuff. They're putting people on myomonitors and electromyography and all kind of machines and medications and dry needling that at very best don't prove anything, might look important, but doesn't solve the problem at all. Then once the brainstem activates the sympathetic output, the sympathetic drives scalene muscle contraction. Sympathetic activation causes sustained contraction of the scalene muscles, especially the anterior and medial, to hold the head motionless. And this compresses the brachial plexus. The tightened scalene muscles squeeze the brachial plexus as it passes between them, leading to arm, hand, and finger tingling and numbness, and sometimes pain. Isn't that amazing? Isn't that amazing? I am watching my live viewers. I haven't seen any questions yet, but I encourage anyone who would like to ask me a question or make a comment, please do. I would like to know what you have to say or think about what I just explained as to how inflammation within the temporomandibular joint can create arm, hand, finger tingling and numbness, as it creates each and every one of those other symptoms. And when you make the inflammation within the temporomandibular joint decrease by placing the patient in a oral device that separates the posterior teeth, and why that works is because 90% of the loads on the temporomandibular joint created by function of the posterior teeth. So when you take the posterior teeth out of function, according to a protocol, you have to be cautious. You do not get super eruption of the posterior teeth that have been unloaded. You do not get super eruption within the first 2 months. That is why the protocol is 2 months, 24/7, and patients are cautioned carefully not to go beyond 2 months. but in 2 months you will not see supereruption of posterior teeth in an adult. But that is why the protocol is so important. You just don't use a device like this any old way. I want to just chime in one other point before we finish this up, and that is one of my colleagues years ago had some thoughts and made a device that he called the NTI. I think it was nociceptive trigeminal interruption or something like that. It's called an NTI, and some of the viewers may be familiar with the NTI. The NTI actually has some value to it, but you can't wear it long enough, and you can't speak with it, and you can't wear it 24/7 for the length of time it takes the inflammation to decrease. So the proper protocol is 24/7 for 2 months, nighttime only, the rest of your life. And the NTI has its own internal problems. I'm not going to try to criticize it, but the author or developer of the NTI, Dr. James Boyd, I believe, I tried to investigate. Once I learned about the NTI, I tried to investigate what he knew about it, and I listened to a lecture as to his rendition of how the NTI, which separates the posterior teeth and can do similar things to decreasing symptoms, but doesn't do it long enough, and it has inherent problems. You can't speak with it. You can't wear it 24/7. It's really too small, and it has been known to have some deleterious effects on the few teeth it's attached to. But his explanation of how it works is totally different. In fact, I couldn't even follow his explanation. It actually made no anatomic, physiologic sense to me as to how he was describing the NTI works. The NTI does have some value because it separates the posterior teeth, unloading the joint long enough to allow some inflammation to die down. But if you're going to be successful with this, you have to start out 24/7 for a while to allow inflammation goes up slowly and inflammation goes down slowly. So it has to take some consistency over short term, 24/7 for 2 months, and consistency over long term. It's a tool to use. This thing is a tool to use, no more, no less. And you have to learn how to use the tool, and you will have the effect of it. So that is my description of how important it is to understand how all these disparate symptoms can be created by one common denominator, which is chronic inflammation within the joint, and why it's so important to get rid of the chronic inflammation within the joint. I know that many people have been watching my work here now for the past 5 years. I'm trying to duplicate an oral device. Of course, this device has a patent on it, and I remind viewers that this is patented. And I think that even the NTI group, whatever group that is now, after the developer, Dr. Boyd, gave it to others to use, have tried to have a device on the lower teeth to separate the posterior teeth. The problem is you can't speak with a device over the lower teeth. Learned that with my long-term significant experience treating cleft lip and cleft palate, and what kind of devices you can put in a child's mouth that will allow them to speak. And a upper device is not only the best, it's the only orthotic that you can put in anybody's mouth that allow them to speak with it. A lower device, because it interferes actually with the tongue movement. Patients with an upper device, admittedly so, they immediately want to put their tongue on it, but as soon as they realize that not to put their tongue on it, then they can speak well. But when you have a lower device, you're not going to be able to. It's just in the way of the motion of the tongue constantly. So, with no further viewer comments on this Saturday, I think I'll wrap it up. I hope this information was helpful for you to understand the disease. First of all, hopefully it's helpful that maybe if you run across a TMJ patient who is also complaining of arm, hand, finger tingling and numbness, now you will realize exactly the pathophysiology involved. If you are a patient who has this problem, I encourage you to go to our website, www.urbanektmj.com. That's Urbanek, Urbanek, TMJ.com, to get more information about how you can find a doctor in your area, your city, your state, who can treat you correctly to make all of those disparate symptoms go away. And if you don't have somebody local, you can give that information to your dentist and have him go to our website where he can take a course. He can sign up and can be validated and take a course on how to use this device and protocol because it is patented. He has to take a course on how to use it correctly, and then he can provide it for you in your own backyard. That would be ideal. That would be the ideal scene. With that said, I hope and look forward that we can meet again next Saturday for the next live stream. And if you have any comments, we'll need to save until next time. I'm Tony Urbanek, and this is TMD Demystified.